Eyewitness News is your vaccine authority, and each and every day we are getting answers to your questions. Joining us live is Dr. Luke Davis with the Yale School of Public Health. Hi, Dr. Davis. Is the second dose
Good evening.
Good evening. Is the second dose of the Pfizer or Moderna vaccine a different makeup than the first dose, or is it basically the same thing again?
So there's some perception, I think, among patients that they might be different, but they're the same exact type of vaccine, the same dose. It just gives your immune system a chance to respond and develop a little bit stronger response. What we're seeing is that the first dose provides around 80% effectiveness. That's for the Moderna vaccine. Whereas getting the second dose about 2 weeks after that, you'd be about 90% protected from the virus.
Well, Patricia is asking, will we need to get booster shots after we get the initial vaccine? And then will we need to go through the nightmare of trying to schedule it?
That's a great question. Well, we don't yet know the answer to that question. There'll be two things that we'll have to find out. One is, how long does immunity last? Right now, we think it probably lasts about 9 to 12 months. And so it is highly possible that by the coming fall, many of the individuals that were vaccinated around the holiday time in the first of the year would benefit from a additional booster. The second thing that we're not sure about is with the new variants that are out there, whether we might need a different type of vaccine. This booster might give more protection against these variants. It'll just take a little bit more time to see which variants emerge and how effective the current vaccines are against those variants. In terms of scheduling, that is a challenge. And we don't know, of course, what will be like, but I think the fall will be a little bit better. It'll be more like our annual influenza vaccination, where there'll be a longer period of time to schedule your vaccine. Also, I think we're going to learn a lot from the adult vaccination program that we've rolled out here. I think people forget that this is something completely new. And just getting into our fourth month now, we're making a lot of headway, particularly in Connecticut. And I think people can be hopeful that the process will just get smoother as time goes on.
I see. Okay, Dr. Davis, what about if I have a dental procedure scheduled soon after the vaccine? Should I change it?
It's a good question. I think the biggest thing to be worried about after the vaccine is how you'll feel. Most people don't have any problem with the first dose of the vaccine, but if you're getting Moderna or Pfizer, many people do experience inflammatory symptoms. So fevers, having some muscle aches, feeling tired. And if you would not want to be in that situation while you're going for a dental procedure, it might make sense to postpone your procedure if it's scheduled in the first 24 to 48 hours after your vaccine. In terms of any safety related to the vaccine, there'd be no worries there. So you could just go along as long as you're going to be feeling well and you've allowed that 48-hour period to pass after the vaccine.
All right. Well, Dr. Davis, thank you so much for your time and your insight this evening. We appreciate it. Take care.
You're welcome.